Hey guys, today I'm going to talk about how antidepressants, SSRIs, actually decrease your testosterone levels, which then causes all sorts of problems, obviously in the bedroom, at the gym, muscle loss, performance, and so forth. And it actually causes other negative hormones. So if this is something you're dealing with, if you're taking an antidepressant, if you want to improve your testosterone levels, if you're having some of these problems, then today's video is for you. I'll discuss natural solutions. As always, at the end of this video, below in the description area, I've got links to solutions for this. Best, vitamins, best minerals, additional videos, blog posts, and so forth. So with that said, let's get started with today's video. Did you know that clinical depression affects 1 in 5 adults in the United States? That's 20% of the population. Unfortunately, sexual side effects are among the most common complaints about antidepressants for both men and women. Now, men tend to lose their desire and, worst of all, their ability to perform, which can cause psychological problems of depression and anxiety in and of itself. And to guys, it's a big deal when things, don't work down there. You just don't feel like a man anymore. And women also lose their desire. They're less lubricated and have to work much harder at achieving an orgasm. And when they do, it's not as satisfying. Now, in addition to sexual side effects, weight gain is another major complaint in up to 40% of antidepressant users. So, what does lowered libido and weight gain have in common? Basically, hormonal imbalances, and more specifically, a decrease in testosterone levels while simultaneously increase in estrogen levels, which ironically further decreases testosterone levels. And remember, testosterone is the key hormone in all animals, male and female, that controls your libido, your sex drive, your muscle mass, your strength, your fat loss, and yes, improved mood. And lastly, one of the causes of the decrease in testosterone levels with the use of antidepressants is a decreased production in FSH and LH. And for men, this means actually a decrease in testicular size as well as sperm production. It obviously makes conceiving a baby more difficult for both men and women due to that decrease in FSH and LH. Ironically, though, an increase in testosterone level acts as a natural antidepressant. So this whole decrease in testosterone level will actually further increase negative feelings and depression. And this is how drugs work, unfortunately. They try to fix one problem, which then causes multiple other negative problems, and it eventually leads to making the original problem even worse than when you first started. And this now creates negative addictions of increasing the dosage of the drug and or adding other drugs to combat all these negative side effects. Well, this is big money for the pharmaceutical companies, but big health problems for you and me. Okay, so the next question is, which medications cause the most sexual side effects and testosterone problems? Now, sexual side effects and lower testosterone levels are linked to actually all antidepressants, but some types of medications cause greater problems than others. Now, the following antidepressants are reported having the most problems. Celexa, Cymbalta, Lexapro, Paxil, Prozac, and Zoloft. And as you can see, these are also the most popular antidepressants and the most commonly prescribed. Now, Wellbutrin tends to have lowered sexual side effects than others, and hopefully we're assuming lower testosterone issues. So the next question is, what's the solution? All right, well, I can't give you medical advice here, so you need to speak to your doctor. However, I can report to you what's worked for many other people. The first thing you can do is you want to maybe lower the dose of the drug. You see, many times doctors prescribe just a generic dose, a higher dose of the drug that's needed. Remember, drugs are super powerful and a little goes a long way. The next option is to change the drug. Again, as I stated, not all drugs work exactly the same or affect you the same. For example, as I stated earlier, Wellbutrin seems to have the least likely to cause sexual side effects, and thus we're hoping the least likely to lower testosterone levels the most. Granted, there are no clinical studies measuring testosterone levels with the use of Wellbutrin. Only this is based on sexual feedback. Again, you'll need to speak to your doctor about this. Your final option is, to take natural solutions. I believe nature always has the answers. There are natural herbs and vitamins and minerals and amino acids that help improve, for example, serotonin levels and other neurotransmitters that help create a calming effect, happier feelings, better mood, and more confidence and more control. However, they won't cause a decrease in testosterone levels or sexual side effects because they work naturally with your body, unlike drugs that artificially work against your body. Now, one of the most popular mood-enhancing solutions is called Provanix. It naturally helps balance important neurotransmitters without the sexual side effects or the decrease in testosterone levels, FSH, or LH levels. And I put a link below to the description area for more details about Provanix, how it works, the research, the reviews, and so forth. Also, if you're a guy and you're listening to this, you for sure want to improve your testosterone levels and help balance out your hormones. This will really make a huge difference and improvements in obviously your performance, your sexual desire, and your erections. Again, one of my favorite and most popular solutions is Alpha Viral. Basically, it's an all-in-one solution that I personally have been using for over 20 years. More details about Alpha Viral below in the description area and how it improves testosterone levels, libido, and all that stuff. Now, the good news is that both of these natural supplements are safe to take with your antidepressants and SSRIs. People have not reported any negative side effects. Now, many people actually end up using a lower dose of their medication after a while, so that's another benefit. Of course, you should always speak to your doctor first. Remember, make sure you educate yourself because this situation is not magically going to fix itself one day, all right? It will for sure negatively affect your relationships if you don't fix this, and that's not good for your mental, emotional, or physical health. Please leave your comments below. Let me know if you've taken any antidepressants and how it's affected your libido, your testosterone levels, your mood, pros and cons. As always, make sure you subscribe to this channel if you aren't and click the bell icon so you'll be notified. And as always, wanted to wish you a very happy and healthy day.